Amongst the partners that we work with in terms of strategic information are sites. This technical arm of USAID in supporting partners who implement USAID projects has been quite influential in the way we handle data. And it's this data that we use as we do our implementation in terms of planning and in terms of targeting. The capacity building that SITES has offered to the prime M&E team has supported the prime to support the implementing consortium members on how to manage data and how to use that data for their planning. This has been spread out to include the local governments. They have supported us to roll out the district action centers where information is received from the child helpline and is processed in order to be able to handle issues from wherever these issues are coming. Because these people call in and this one is captured at the district. This support has included at the district action centers provision of laptops, provision of a phone, and the provision of data so that these people are able to have this information processed when it comes in. As a consortium, that means that the knowledge in data management that SITES has passed on to the prime as well as to the implementing partners has equally been passed on to the local governments with which we work in the region. So this means that the technical arm of USAID, which is the funding agency for the keeping children healthy and safe, has used the funding received from USAID to support the data management processes, which data management processes have generated data that we are using to identify which beneficiaries we have to target. Because we have 5 categories which we target when we are enrolling households on keeping children healthy and safe. And these include households that have children who are living with HIV, households that have HIV positive caregivers but who are not suppressing, households that have children who have experienced violence, households that have children and are headed by female sex workers, and households that have adolescent, pregnant, or mothers. So all these categories have been identified using data and knowledge that we have received from sites. So now with the funding that we get as keeping children healthy and safe, we have gone out and reached these children in their respective households. As we talk today, KCHS is working with 19,010 households in the 17 districts with a target of 63,523 beneficiaries. Now it's these beneficiaries that we have reached with the case management. These are beneficiaries we have reached with economic strengthening support, and then we have reached the children in the age 9 to 17 with prevention messages and life skills in order to identify cases of violence against them and how to avoid infection through reckless lives. So they have been empowered to prevent themselves from HIV infection. So overall, the partnership with support from USAID, has helped KCHS to work with the local governments to give them information on which cases exist within their respective lower local governments and higher local governments, and then plan together, especially when we are holding what we call stakeholder meetings, where we bring together civil society organizations, we bring together the police, we bring together the judiciary, so that the issues identified are handled in a holistic way, because there is no one partner that can meet the needs of all the children and vulnerable households.